Singapore is studying if it should extend the time between COVID-19 vaccine doses as it approaches phase 2 of its vaccination drive.
For a closer look, we're joined by Dr. Dale Fisher. He's chair of the WHO Global Outbreak Alert and Response Network. Dr. Fisher, several other countries have recently opted to delay their second doses as well. Do we know what the results are and how effective this is?
Hi, Dawn and Steve. Yeah, it's an interesting strategy and seems to be very successful. It's been done in UK, a couple of Scandinavian countries, Denmark, Norway, France, US, Canada, as far as I know, probably others. The strategy is all about can you give the second jab later and therefore allow more people to get the first jab. So obviously you don't want to compromise those people that are due for their second shot, but and also is the first jab successful in its own right? And the answer is yes. There's growing evidence that actually the first jab has got like 80% effectiveness, and actually if you delay from 3 or 4 weeks out to even 12 weeks, some of these studies are showing that there could even be an enhanced response overall. So there's a lot to be said for delaying this so that we get more people with that first jab.
Dr. Fisher, help us understand then what actually happens after the first jab versus the second, and what difference does it make to delay the second shot?
So it's all about getting the second shot to enhance the effect of the first shot. And what is the timing of this? Now, the timing of this was first determined in those very early clinical trials, even in the first half of last year. But now that we've got real world data, we can see that actually we can lengthen that period. So you can imagine if there's, say, 200,000 people maybe in the next few weeks are due to get their second dose, and we say, okay, you can delay that quite safely, and then that gives us the opportunity to vaccinate a whole lot of people with their first jab and make them virtually as immune. So, and you catch up later. So it's a good fast forward. It's a good opportunity for us to give this a kick along.
Dr. Fisher, let's get your take on what we've been seeing here in Singapore of late. I mean, given the increasing cases and clusters in recent days, is there a noticeable pattern emerging to you?
There's certainly a lot of cases and clusters, and this is new territory for Singapore through, or at least for the last year or so. The two largest clusters are Changi and Tan Tock Seng Hospital. At least this afternoon, Changi was at 74 and Tan Tock Seng was 46 altogether out of the 15 active clusters. So we've seen some workplace spread. We've seen some spread within households to close family members. And this is really to be expected, especially the home transmissions, because that's where people relax and the cleaning is less intense and you don't wear masks and that sort of thing. So that's expected. What we're seeing out of these cases is I guess the challenge that comes where the epicenter looks like it was the Changi Airport cluster, and that of course is more than an airport terminal, right? It's a mall where people can just come and have some meals and then move off. So a lot of these clusters are actually, we're finding out later, are actually connected to this major cluster at Changi Airport. We're also finding a lot of mild disease and a lot of asymptomatic disease, which makes it even harder to track, because these people don't know that they've got COVID, yet they're still walking around not as an identified contact of the cluster. Identifying a contact certainly has more challenges with this more highly transmissible variant. Someone who may not have been a contact with the more traditional variant, we might have to cast a a broader net, I guess, to find more of these people. But it's also a reason why we need to bring in these blunter measures like the decreasing the sizes of the groups and all the things that people have been reading about over the last day or three.
Well, thank you very much for your thoughts this evening. As always, Dr. Dale Fisher, Chair of the WHO Global Outbreak Alert and Response Network.